everybody, this is Lisa, your favorite spoon bunny, and welcome back to the Life Spoontastic. Today I'm going to begin chatting about how to understand someone with chronic pain, and depending on time, I may have to split this up into multiple videos, but we will see how this goes. You will see me referring to notes again from time to time, and for that I will apologize, but what can you do? Brain fog. So again, we're going to be chatting about how to understand someone with chronic pain. And the reason that I'm doing this is because, as caregivers and as loved ones, as family, sometimes you may not fully understand what's going on with your patient. And you may not always understand that your words and what you do may not always be helpful to us. And you don't quite know why, but I'm going to explain it to you today. Of course, chronic pain is a condition that lasts for 3 months or more, and it continues long after the injury or the condition has been treated or healed. The experience of acute pain is the nervous system's natural response to any sort of injury or infection. And with chronic pain, of course, the pain response, it continues abnormally. It continues, the nervous system continues to relay the pain long after the injury or the infection or the surgery has healed. This can be both stressful and completely exhausting for the chronic pain patient. And in some cases of chronic pain, there was an injury, an illness or infection that first caused the pain. In other people, however, the chronic pain appears and continues without any sort of history of any such event. It just shows up. And so to understand chronic pain sufferers, you need to learn about chronic pain itself, be supportive, and know what to say and, of course, what not to say. So the first thing you need to do is learn about chronic pain itself. Find out more about your patient's pain. Every single chronic pain patient's experience is unique and it's different. It might be helpful if they explain a little bit to you about what their condition is like and what their daily battle with their pain is like. The more you know about what they're going through, the more you're going to be able to understand them, and the more you're going to be able to help them. Did they suffer a back injury or a serious infection? Or is there an ongoing cause of the pain, such as arthritis or diabetic neuropathy or some other form of nerve damage? Understand when the pain started, and do some research of your own. Read stories about people with similar issues. Sometimes doctors can't find the source of the pain. It, sort of remains a mystery diagnosis, a mystery illness. But the doctors are aware that the patient is suffering on a daily basis. Don't ever push a chronic pain patient to talk about things that they don't want to. For some of them, bringing it up just makes them feel worse. Common chronic pain complaints include headache, low back pain, arthritis, pain from damage to the peripheral nerves, or even to the central nervous system, Sometimes pain even begins without any known source. And of course, for myself, the pain began with just a tiny little broken finger and ended up spreading to all 4 of my limbs, and even to some other sites that are completely unrelated because of new surgeries and new procedures. And it all caused my CRPS to spread to every single one of those sites. New injuries, new surgeries, of course, it's going to spread. A person can have more than one coexisting chronic pain condition, such as chronic fatigue syndrome, endometriosis, sciatica, peripheral neuropathy, inflammatory bowel disease, depression, CRPS, spinal disorders such as scoliosis, herniated discs, spinal stenosis. You can have coexisting conditions, comorbidities, multiple diagnoses that can cause, pain in just about any area and every area of your body, including, migraines and trigeminal neuralgia and occipital neuralgias that cause issues in your neck and even in your face. You've got to accept that, simple words may be inadequate to describe how your patient is feeling. Try to remember a time when you experienced a lot of pain, like a broken bone, and imagine that pain is present in your life 24 hours a day, 7 days a week, without relief for the rest of your life. It's hard. It's really difficult to find the words for that kind of pain. The next thing you're going to want to do is learn the code. A numeric pain scale is used to measure pain intensity so that healthcare providers can check their treatment efficacy, how well their treatment is working. A scale from 1 to 10 describes the pain level. A 1 is no pain at all, I feel great. And 10 is the worst pain ever felt. And in fact, my own doctor, he improvised a new pain scale for us at his particular office that, includes 9 or 10, or excuse me, a pain level of 9 is equivalent to being mauled by a bear or ninjas, and 10 is unconscious. You're in so much pain that you've just passed out. And I much prefer his pain scale to the normal 1 to 10. But ask your patient where they are on that pain scale, and they'll tell you. Sometimes they'll even go so far as to tell you that they're at a 15. It's that bad. But go ahead and learn the code. The 1 to 10 code, and they'll let you know for sure. Don't assume that the chronic pain patient is not experiencing pain ever. If they tell you that they're okay, that just means that their pain is tolerable and that they can deal with it that day. Many chronic pain patients hide their pain just because there's so much of a lack of understanding in the Normans of the world. There's a lack of sympathy and a lack of patience, as it were, amongst the Normans. So we become very, very skilled at hiding our pain. When asked about their pain level, chronic pain patients may not give you their actual level of pain. Because their pain is chronic, they're accustomed to a certain level of pain, and they may just accept that as normal or no pain at all. They may only give you a correct level of pain when they have some form of acute pain. When the normal level of pain that they live with changes for some reason. When they experience pain that now feels different, when it's not a normal pain that they experience, i.e. shooting pain instead of aching, burning instead of throbbing, or when they're asked directly about their current levels of both acute pain and chronic pain. Or, as in my case, last December, I had pain in my abdomen that was not normal for me. It was located in my upper abdomen, just below my rib cage, and that wasn't a normal pain for me. And it was pretty severe. And so I told my husband, you know, this isn't right. Something isn't right. This is not normal for me. And so we went to urgent care. They did a CT scan, and they told me, you know, sweetheart, you have pancreatitis. And I was like, what? And they immediately put me in the ambulance and sent me straight to the hospital. And I spent 4 days in the hospital, simply because my pain wasn't normal. You know, I didn't know what was wrong. It wasn't normal, and it turned out I had, you know, something that could kill me. And so I spent 4 days in the hospital with no food, no water, no ice, no nothing but IV fluids. And the instructions to let my gut rest and let the nurses give me pain meds intravenously. And that was it. Later on, we found out that I had bile duct stones, even though I had not had a gallbladder in 23 years. Like I told you in the last video, my body does really weird things. But when a chronic pain patient tells you something's not normal and their pain is off, it's doing weird things, that's when you gotta listen and understand that, something is not right. But moving on, when it comes to your chronic pain patient, you need to learn to recognize their coping skills. When you have the flu, you probably are pretty miserable for a few days or a few weeks, but you do the best that you can to function. Chronic pain patients have probably been feeling pretty awful for a really long time. For me, it's been 5.5 years. They may have adopted coping mechanisms that hide the real level of pain that they feel, or they may not have the strength to function normally. So instead, they'll just sort of stay in bed, read a book, play on the computer, just watch TV. They'll have a few coping mechanisms that they've learned to use to adapt to their normal. Be aware, be on the lookout of depression symptoms. That's important, especially for caregivers. Beware of depression symptoms. Chronic pain can cause secondary depression in many patients. And of course, wouldn't you get a little depressed and down if you were in pain constantly for months, years, decades? Depression may be due directly to the chronic pain, or the chronic pain may be due to the depression. It's a vicious circle. Depression can cause some people to show less emotion, which can mask the pain because the sufferer just no longer makes it known. Always be on the lookout for signs of depression, and don't confuse this with there being any less pain. Depression may also cause people to show more emotion. Crying, tearful all the time, anxious, irritable, sad, lonely, hopeless, fear of the future, easily agitated, angry, frustrated, hyper or over talkative due to the medications, the need to vent, the lack of sleep. This, just like their pain, it can vary day to day, hour to hour, minute to minute. And one of the worst things that you can do is abandon someone with chronic pain. That just gives them one more reason to be depressed, one more reason to be lonely, one more reason to not be very positive and to beat themselves up. Try to be there for them and give them support however you can. And don't just say, let me know if there's anything I can do for you. Because that's just a throwaway line, honestly. If you truly, truly want to help someone with chronic pain, ask them instead, how can I help you? What if I did a load of laundry or two for you? What if I take your dogs for a walk once a week? Or what if I walk your dogs for you every day from now on? Or what if I come and vacuum for your house, vacuum your carpets once a week? Make suggestions as to what you can do to help. Don't just use the throwaway line, because that's kind of hurtful, that one. That just says to us, well, he's just offering to help, but he's not really going to help. Or she is not really going to help. But if you make specific suggestions as to what you can do, or offer specific suggestions as to what you can do, and then you follow through, that means a whole heck of a lot. And we will treasure that forever. The next thing you've got to do is respect our physical limitations. With many diseases, a person will show obvious signs of their conditions, like paralysis, fever, or broken bones. With chronic pain, however, there's no way to tell what a person's ability to cope with movement is how to cope with movement is like at any given moment. You can't always read it on their face or in their body language either. The sufferer may not know from day to day how they're going to feel when they wake up. Each day has to be taken as it comes. And this can be confusing for everyone, but it's very frustrating for the patient. Being able to stand up for 10 minutes doesn't mean that the patient can stand up for 20 minutes or an hour. And just because the patient managed to stand up for 30 minutes yesterday doesn't mean that they'll be able to do it today. And movement isn't the only movement isn't the only limitation that chronic pain patients might experience. Their ability to sit, walk, concentrate, and be sociable can be affected as well. Please be very understanding if the chronic pain patient says that they have to sit down. If they say they have to lie down. or even if they have to stay in bed or take these pills right now. It probably means that they have no choice and they can't put it off just because they happen to be somewhere or they're in the middle of doing something. Chronic pain doesn't wait. Not for anything, not for anyone, ever. If they need to sit, they need to lie down, and they need to take their pills right at that moment, it means that they are not able to continue unless they do that very thing at that very moment. Next, you can look for signs of pain. The grimacing, the face making, the mean faces, restlessness, irritability, the mood swings, the clenching of hands, wringing of hands, the grunting and moaning, the sleep disturbance, the teeth grinding, the poor concentration, the searching for words, the decreased activity, or perhaps even writing down suicidal thoughts, language that can indicate distress or pain, even the loss of motor skills. My friend Vanessa has taken note of, as the day goes on and I start feeling worse, my motor skills in my hands go out the window, and my fork or my knife or my spoon at the dinner table goes flying at any given moment. And that's an indication of the fact that my hands are beginning to suffer the consequences of my daily pain. The tripping and the falling, or the near falls, that's another consequence of my daily pain. The loss of balance, because my feet are hurting. That's another incidental of the daily pain. It's a sign of pain. And so be sensitive to what your patient is going through. Look for those signs of pain and, try to help out wherever you can. Understand and know that chronic pain is the real deal. It's been observed by physicians and doctors across multiple disciplines, and it's been documented for at least 100 years. You might think that chronic pain patients go to doctors because they're attention seekers, because they enjoy it, or because they're hypochondriacs. This is not true. It is not the case. What they're actually doing is looking for something, searching. They're desperate to improve the quality of their life. And often they're looking for the cause of their pain if they don't know what it is, if they can't figure it out. Because sometimes they have to go to several doctors before anyone can figure it out. No one wants to feel the way that they do. None of us want to feel the way that we do. We don't have a choice in the matter. When I injured my finger and started this CRPS journey, I wasn't looking for it. I wasn't asking for it. It was a freak accident. But here I went. I broke a finger. That's how it started. And it started crawling up my forearm. And I went to the orthopedist and he did a surgery and it started spreading up the rest of my arm. And through subsequent injuries and surgeries, now I have it in all 4 of my limbs, plus a few other sites that I didn't expect due to other injuries and surgeries. I never went looking for this. I wouldn't wish this on my worst enemy. Ever. So chronic pain patients don't want this. They would never, ever, ever go looking for this. This is not something that we choose just because we want attention or sympathy or pity. It's just something that happens to us. And if we could wish it away, we would. If we could pray it away, we would. If we could positively think it away, we would. The next thing, recognize what you can't know or what you don't know. Pain is a difficult thing to describe to another person. It's something that you feel personally, and it's based both in your psychology and in your physical body. Even if you're a very empathetic person, never assume that you know exactly how it feels to be a chronic pain patient. I mean, sure, you know how it feels for you, but each of us is different. And it's just impossible to get inside a person's skin and feel their pain. So, with all that said, that's the end of part 1. And it turns out that we have run long. So, I will get to part 2 another day. And hopefully, this has provided you with some valuable information on how to love on your chronic pain patient, how to encourage them, how to be there for them, how to truly be of help to them, and how to support them in every way that you can. Until next time, my friends, this is the Spoon Bunny, signing off. May your spoons be plenty, and your troubles be few. Have a great day.